Our eyes are constantly sending us messages. But do we really know how to read them? From just a little bit of blurriness to a sudden flash of light, every little change can tell a huge story about our health. So in this explainer, we're going to decode those signals. So does the world ever seem just a little out of focus? Or have you ever seen those tiny little specks just kind of drifting across your vision? Well, these are incredibly common experiences, and they're exactly what we're going to break down. Okay, let's dive right in. Okay, first things first, we gotta understand that our vision isn't just static. It's on this whole journey right from the moment we're born. What's normal for a kid's eyes is totally different from what's normal for an adult's. And these changes, they start really, really early. So let's take amblyopia, what most of us call a lazy eye. This is a perfect example of one of those early developmental issues. Basically, one eye just doesn't learn to see right because the brain starts to favor the other stronger eye. And here's the key thing. There is a critical window for treatment. Getting in there before a child is 7 or 8 years old gives them the absolute best shot at developing normal vision in that eye. All right, so for most of us, vision issues aren't really about development. They're more about simple physics, a problem with how the eye focuses light. Let's look at the main reasons why millions and millions of us end up needing glasses. First up is myopia, or what we all know as nearsightedness. Think of your eye like a camera, right? In a nearsighted eye, the eyeball itself is just a little too long. What that means is the light focuses in front of the film, the retina, instead of right on it. The result? You can see things up close perfectly fine, but stuff in the distance, it's all a blur. This usually pops up in childhood, right around elementary school age. And on the flip side, of course, we've got hypermetropia, or farsightedness. With this one, the eyeball is a little too short, so the light wants to focus behind the retina. To deal with that, the lens inside your eye has to work overtime, constantly flexing to pull that focus forward. And all that extra work? That's what gives you those classic symptoms of eye strain and headaches, especially after you've been reading or staring at a screen. So let's just break it down side by side so it's super clear. Nearsighted, your problem is with things far away. Farsighted, the real struggle is with things up close. And honestly, even seeing far away can take a lot of effort you don't even realize you're making. And then, oh yeah, there's the one that gets pretty much everyone eventually. Presbyopia. This isn't about the shape of your eye at all. It's about the lens inside your eye. As we get older, usually sometime after 40, that lens just naturally gets stiffer. It loses its flexibility. It can't change shape as easily to focus on things up close. That is exactly why you start seeing people holding their phones or menus way out here trying to get it in focus. It's just a totally normal part of aging. But as we get older, things can get a little more serious. Some vision changes can be signals for bigger problems. It's not always just a simple case of needing a new pair of reading glasses. And this right here is a really critical point. Before you're 65, blurry vision is probably just a simple focusing issue. But after 65, it's much more likely to be an actual eye disease. And that's why paying attention becomes so much more important as the years go by. One of the most common age-related conditions is cataracts. So what's happening here is the lens in your eye, which should be totally clear, starts to get, well, cloudy. It really is like trying to look through a foggy or a dusty window. Your vision gets dim, colors can look all faded, and that glare from headlights at night can become a serious problem. Okay, next up is a big one, macular degeneration. This condition hits the macula, which is the very center of your retina. It's responsible for all your sharp, detailed central vision. This is the vision you use for, well, everything. Reading, driving, recognizing people's faces. And a classic telltale sign is when straight lines, like a door frame or the tiles on a floor, start to look wavy or bent. And then we have glaucoma. And this one is often called the silent thief of sight for a really scary reason. It usually has 0 symptoms in the early stages. It slowly, painlessly steals your peripheral or side vision. You might not even notice anything is wrong until a ton of irreversible damage has already been done. Okay, we've covered the day-to-day stuff and the chronic conditions. Now we need to get serious. We're talking about real emergencies. The symptoms we're about to cover are major red flags. These are not wait-and-see situations. And I need to be absolutely 100% clear here. If you experience any of the things we're about to talk about, it is an eye emergency. You need to see an eye doctor or get to an ER right away. Think of this chart as the fire alarm panel for your eyes. Every single one of these symptoms signals a potentially sight-threatening emergency that needs immediate action. We're talking about sudden vision loss, a weird curtain or shadow, a brand new storm of floaters and flashes, or suddenly seeing double. Let's just spotlight the most critical ones you absolutely have to recognize. And when we say sudden, we mean sudden, like someone just flipped a switch and the lights went out in one eye, or the vision in that eye just abruptly goes gray. This kind of painless, total vision loss is one of the most urgent signals your body can possibly send. It can mean something very, very wrong, like a stroke in your eye. This next one is anything but subtle. People describe it as a literal gray or black curtain being pulled across their field of vision, usually starting from the side. That feeling? That's the retina actually peeling away from the back of the eye, and it needs immediate medical attention to save your sight. Okay, let's be super clear here. We are not talking about that one little floater you've had for years. No, this is totally different. We're talking about a sudden storm of new spots, sometimes described like a swarm of gnats or pepper just filling your vision, and often it's combined with flashes of light. That combination is your eyes screaming alarm bell for a retinal tear. Okay, so with all this in mind, when something goes wrong, who do you even call? Knowing the difference between the eye care pros is really key to getting the right help fast. So here's an easy way to think about it. The optician is the expert who fits and makes your glasses. The optometrist is like your primary care doctor, but for your eyes. They do the full health exams, write prescriptions, and they're the ones who will likely first detect diseases like glaucoma. Then you have the ophthalmologist. This is the specialist, a medical doctor and surgeon who treats complex diseases and performs surgery for things like cataracts or a detached retina. For any of those emergencies we just talked about, you need an optometrist or an ophthalmologist. Look, we only get one pair of eyes. Their health is absolutely vital to our overall well-being. From something as simple as a new prescription to a sight-threatening emergency, the signs are all there. The real question is, are you listening?